sure will be along.
Recording in progress.
Okay. So I'm going to call the meeting to order. It's November 9th, Town of Reading Board of Health. And we'll start with a roll call for attendance. Paula?
Here.
Carrie?
Here.
Jerry?
Here.
And Rick Lopez. So in terms of tonight's agenda, we're going to review the minutes, approve them for last month's meeting. We'll have a public comment section if anyone wishes to make a comment. We have a couple situations, one 601 Haverhill, that we need to discuss and decide on a compliance time for remediation of the issues. And then we have 166 High Street, similarly, a discussion of what's going on there and how we tend to handle it. And then we have a shared services agreement update from the coordinator, Annette, who has joined us. Hi, Annette.
Hi, Annette.
And
Hi, Annette.
some quick updates on the House bill for changing the membership requirements of the board, a day's regular monthly report, and final comments. So that's the plan for tonight. We can start with the minutes of October 12th, and they looked fine to me. Any suggestions for edits or comments?
One minor grammatical one.
Sure.
Under performance standards, then you have, you said Carrie Dunnell. I just thought it might read better if you said, it says Carrie Dunnell states that this is the first time there will be a set of performance standards in Mass, and it is basic but provides a baseline for public health. Make that 2 sentences. I think it would read better. If you would.
Yeah.
There you go.
Great.
Perfect.
Thank you, Paula.
And that was the only thing. Sorry, I'm just sort of anal.
That's right.
From October 12th, do I have a second?
Second.
Second, Carrie. Roll call, Paula,
Yes.
Carrie,
Yes.
and Rick. Yes. So the minutes are approved. I don't see anybody here from the public to weigh in or make a comment, so we'll move on from that agenda item and directly to the discussion and vote on 601 Haverhill. And so I'll turn that over to Aday for his overview and introduction.
All right, thank you very much, Dr. Lopez. And I believe Mr. and Mrs. McAllister are on this meeting as well. So I'm just going to give a quick overview and get the owner's comment as well, and then move forward. So there was a fire at 601 Haverhill Street, and the fire department got there before us, and they gave us a call to come in and take a look. We found multiple violations that needed to be corrected. We informed Mr. McAllister. He's the owner, and he has been very cooperative. He's currently working on bringing the house back into compliance, And our letter stated that he needed to get everything done within 30 days, but it appears that he's going to need more time to achieve compliance and get his house back to order. So yeah, Mr. McAllister would like to request an extension of the compliance time. Mr. McAllister, would you like to say a few words about this?
Yes, I would. You can hear me.
Yes,
Yes.
Okay. Thank you very much for listening to me. My understanding is from the insurance company, Preferred Mutual, that it's definitely going to take a considerably longer time than 30 days. First of all, to go through the insurance issues to approve funding for it, but also just the remediation itself. And my understanding from my own public adjuster when he first came in was he talked to me about 6 months and more. So I don't know if the insurance company is talking that kind of time or not, but I guess under that circumstance, I would like to ask for an extension to a full 6 months, and possibly with the understanding that if I can't get it done in 6 months, I might come back to the board for another extension.
Can I ask a question?
sure.
Just to confirm that no one is living there now, correct?
Correct.
And you have housing?
I stayed with my daughter for a couple of weeks, and now the insurance company's provided we're in an extended stay for the next 2 to 4 weeks, with the idea that they're looking for something more permanent for 6 months or whatever the length of the process might be.
Okay, I just want to make sure you're taken care of.
Well, thank you much. We are.
This is not surprising. Actually, my son, about 3 years ago, had a chimney fire, which in his new house, which, the firemen came and then they pour water over and they create a lot more damage than the fire originally created. And he had to rent a house for several months, going through the process of doing all the insurance repairs, adjustments, and and process. So this is actually not typical, probably not unusual when there's extensive damage. And I think Paula's comment is, as long as no one's living there, which is our main concern around human safety, and then the process just needs to play itself out, in my opinion.
A day, Rick, if I may, have you discussed whether there be some sort of regular schedule for check-ins and progress? So, how is it that your office would like to manage the timeline for this?
I think we're just going to rely on Mr. McAllister to keep us updated.
Okay. Great.
I can obviously check in every month or sooner if there's more progress, but I can always check in and let them know every month, assuming they let me know.
Right.
Any other thoughts, comments, suggestions from the board members? Yeah.
No.
Do
Paula?
we need to have a specific, a set date to move forward?
Yeah, that probably would be a good idea. So 6 months, let's see, we're in November,
November,
January, February, March, April.
April, end of April, beginning of
Yeah.
April?
Yeah, let's, maybe we can say May 1st and we can, and at that point, if the remediation is not complete, we would need to have it come back to the May meeting of the board.
So
So-
either way, a day could update us at that May meeting on
Absolutely.
this.
Either way,
Right.
yes.
Yeah.
That's a good point. So I make a motion to agree to extend the remediation compliance period until May 1st, 2024, with an update from or if compliance is not met by that time, a board agenda item in May to decide on any future changes or further extensions. Do I have a second? Paula, second. Roll call.
It was
Carrie,
going the wrong way.
Yes.
Paula,
Yes.
and Rick, yes. So thank you, Mr. McAllister, for coming and explaining what the situation is. I'm glad things are going to move ahead to remediate the situation, and we have a current extension to May 1st, and hopefully it will be completed by then.
I hope so too.
So thank you for,
Best of luck to y'all. Take good care.
Thank
Yeah.
you very much.
absolutely. Take care.
Have a good night.
Bye-bye.
Bye.
Okay, a day. Moving on to 166 High Street.
All right. So 166 High Street, I believe Mr. and Mrs. Yang are on this meeting as well. And I'm just gonna give a brief overview.
Yes, we are here.
Okay, sounds good. So I'm just gonna give the board a brief background on what has been going on. And after that, we'll let you speak. And then the board will decide, what to do in terms of the situation at 166 High Street. So basically, we received a complaint from a neighbor in July. The complaint alleged that the occupants of 166 have a large number of chickens, ducks, and a couple of roosters. It also alleged that they are keeping birds without a permit and having a poultry count way over the limit. The complaint also alleged that the roosters are very loud and the sanitation and maintenance were insufficient, and they are starting to see a lot of rodent activity on their property as a result of that. So the health department went out, and we did indeed confirm at least one rooster, and Mrs. Yang was very cooperative with us. She rehomed the rooster, and the issue of the rooster got eliminated. We issued a $100 ticket for keeping animals without a license, and the ticket got paid like right away, and which was a little bit surprising to me, and made me wonder why a $100 fine would get paid right away, and the permit application process, which only cost $10, is still pending. And then sometime in September, we received another complaint, and we asked Mrs. Yang to go through the permitting process and complete it. And as a result of that complaint, we conducted another inspection and observed numerous violations. We sent out an order letter, and that's the order right there on the screen. Let's see. In the letter, we ordered the occupants of 166 High Street to apply for a permit immediately. We ordered them to reduce their poultry count down to 6 and limit the number of poultry to 6. We ordered them to provide an adequate living space for their poultry. And we also ordered them to maintain their property in a sanitary condition. On October 16th, we conducted an inspection to determine if they have complied with the orders listed in the order letter dated October 2nd. So during that inspection, we found a total of 8 birds, 5 ducks, and 3 chickens, still over the permit limit of 6. We found rotten, moldy hay bales that needed to be removed and disposed of. We found chicken enclosure that needed to be cleaned. We found rotten, wet, dirty cardboard in the duck enclosure that needed to be removed and disposed of. The yard was filled with soiled wood shavings that needed to be removed, and the duck pen needed to be cleaned. So during that inspection, we gave them 5 days to comply. And we also informed them that we will conduct an unannounced reinspection to verify compliance. We tried on numerous occasions to attempt to reinspect the property, to no avail. And then on November 5th, our animal control officer was able to visually see over and through the fence from the public way. And during this time, they were able to count more than 6 chickens and 6 ducks. Some of the chickens were black and weren't there during the previous inspection. Let's see. All right. So the ACO came back and reported to me, and pretty much they suspect that the occupants of 166 are potentially keeping the birds somewhere on the property, and they're also keeping them out of sight when there's a pending inspection. And as a result, the health department did not approve a permit to keep animals for this location. And we're asking the board to prohibit any activities that include keeping of animals at this location until the occupants can demonstrate the knowledge, the capacity, and compliance needed to keep animals. If the board approves this request to forbid animal keeping activities at 166 High Street, I will issue a cease and desist order next week and begin issuing daily violation tickets in the amount of $100 or greater until compliance is achieved. If these efforts to obtain compliance fail, we will commence for action. And now I would pass it to Mr. and Mrs. Yang to give us their side.
This is Mr. Yang, you're on mute, so if you can unmute yourselves if you have any comments. The mute button's at the lower left-hand corner. Okay, we can hear you now.
So you are. So most of the what I don't know.
Rick,
Oh.
do we need an interpreter for this?
Yeah, I'm acting. I'm in some time.
Can you hear us?
Mhm.
Mrs. Yang? do you
Okay,
have- Do you have any comments to make regarding,
I will clean up the, I will clean up the coop, and I will give the chicken away
okay,
So,
because my friend says
so this is, you know,
so you're saying that you will clean up the yard and
Yeah.
reduce the number of chickens to 6
yeah,
and apply for a permit.
yeah, and we still,
Okay. Is that correct?
yeah, that's what you want.
Okay. Yes, Paula,
Are there still ducks on the property as well?
3 ducks in this.
yes. So it's actually reducing all birds as a category to 6, as I understand it from the regulation.
Yeah.
Okay. A day was one of the aspects of the regulations is providing 2.5 square feet per bird. Do you know if, from looking at the yard, they're in compliance with that?
No,
If
not
they were,
in-
well, if there were 6 birds. Are you,
There's a potential that the animal control officer could work with them to be in compliance. Yes,
okay.
but as it is right now, no, they're not in compliance. We also give them enough time. This has been going on since July. We've been reasonable with them. So if they're asking to do what we've been asking them to do since July, I'm not sure why we should trust them and give them that opportunity to do it again. I just don't. It's the same thing we've been asking for since July, to clean up, reduce the count, maintain the property, and we go out today, the next day, different set of birds in there. The next day, it's just too many things.
Yeah.
So,
So what is your recommendation, Ade?
well, pretty much what I'm asking is to prohibit any animal keeping activities on that property till they're able to pretty much handle everything that's going on. One of my suggestions would be for them to contract with a poultry farmer that can help them set things up and limit the birds to 6.
And
Something.
is there a time frame that you're looking at?
Well, I mean, this has been going on forever. I don't know how long we can keep doing this. I don't know. It's like different sets of animals, different sets of birds every time we go out. It's like we cannot get a full count. There was one time we went there and it was over 20 something birds. Another time it was 8. So we can't keep up.
Kevin, did you have a comment?
Yeah, I mean, this hasn't come up too much in the past. I know this was a town meeting regulation that the Board of Health was put in charge of. So I guess what it sounds like, what you're looking for, Dave, and it sounds like probably the simplest solution is they have to work with the animal control officer on removing all the birds so that the property can be set up properly, cleaned properly for 6 birds to then return. Does that sound about right? And
It sounds right, but we've given them the opportunity.
well, I was just about to say, and to that
July.
end,
So
you know, money usually talks when it's regards to this. So what is the fine capacity of the animal control officer if they're not cooperating with them?
So we can go up to $300 per day. I haven't issued a $300 fine yet. I only issued one $100 fine that got paid like almost instantaneously. So we can go up to $300 a day.
Okay.
那他这种控制，就是你每天把你两个快点下来。
是的，
Yeah, you can go now.
Yes, Carrie.
I just want to clarify, has the notice and the request for compliance have been delivered in writing and verbally, and there's the communication, you know, it's been clear that the people, that the Yang family understand what, have said that they understand what the requirements are and that they would be in compliance. Is that accurate?
Absolutely. I even met with Mrs. Young in person in the office,
就是我理解啊。
and we went through the letter together and
Okay.
explained to her what she needed to do. And we went out, and it seemed like everything was okay. We told them when we were going to come out. It seemed everything was okay. But when the animal control officers went out unannounced, they found something different.
Right.
So that's the issue we have.
Right, and that's it, because our job, yeah, I mean, the requirement for compliance is always compliance, not compliance on the day of inspection. And, you know, it'd be the same thing, same principles as when we're looking at if we're doing a tobacco compliance check. You know, it's that, you know, the expectation is that the situation will be rectified and that there won't be a recurrence, that you would be able to inspect at, you know, at an unannounced time and see the same circumstances.
Correct.
And you have been in process on this since July,
Yes.
so 4 months.
Yes.
No, can I say, you know,
Yes.
because my friend says she will pick up the chicken, but they already take some, but still have some not take. That's why. And for the cleanup, I think already cleaned, but I don't know what they need, because the chicken, when the first day I clean up, the second day they pooped again, things like that. So I already sent some give to my friend, but some of my friend, they said that pick up the rest, and so I keep them. I said come to take, but they are not take yet because too many. So
And we also provided
somebody
resources.
already take some, yeah. And the stray dog I really love because they like a dog, like a pets. So
Paula?
Mrs. Yang, what is your first language?
Chinese,
Which dialect?
Mandarin.
Mandarin?
Yeah.
Do we have access to anybody who speaks Mandarin that can go with you or the animal control officer to make sure that all of this is perfectly clear?
Yes, we can make that happen. And also they, you know, they informed us that they have a son that can
no,
help.
problem is my husband before asked me, said, can we have a little bit more time, you know, but you cannot send them, yeah, send out, give us some time. To do that. So before I know they already, since the July, they already give me the time, but so because I cannot read the letter, clearly. So I don't know, time is flying. So I don't want to bother my husband. So until I always think, oh, I will do this, I will do that. Maybe someday I ask my husband, but I don't know, the time is flying. That's why, that's why I got a ticket, the fine. I pay. After pay, I think I do some, my husband said, can we get more time? So you cannot send them to, like this. For the cleanup, I think it's all set. It's I already do, but the animal control says, oh, it's no good. Somewhere else, no good. Things like that. 这个来看看，记得的。Oh, okay.
Rick,
Harry?
if I, Mrs. Yang, I think, we're certainly sympathetic to the fact that there are challenges to, sounds like you have some challenges in getting some things done, but our obligation is to make sure that the regulations are followed and that, we can provide you some assistance, make sure that, there seems to be some confusion about what the, requirements are. And I think that I support Paula's suggestion of accessing an interpreter. I would prefer that we not rely on a family member for interpreting. I would prefer that we have a, my medical colleagues will say, it's not a best practice to rely on family members for interpretation. And I don't want to apply that standard here. I think that it would be worth our while to do so. Mrs. Yang is expressing some confusion about what she understands to be in the letter. I think that interpreter could be helpful with our staff, with the animal control officer, and going through exactly what the terms for compliance are. I would hope that we could accomplish that very quickly. And I want to go back to the point that Kevin raised about what are the standards, or what ability do we have, what need do we have to look at fines, because we are talking about something that's been going on for 4 months. Those are my points.
I wonder also if perhaps a Mandarin speaking social worker might be of some value here.
Mm-hmm. If that's possible, yeah.
A day, have the Yangs applied for a permit at any time in the last 4 months?
Yes, they have applied for a permit, and in order to issue the permit, you have to do the inspection and make sure they're in compliance.
Okay,
But since they're not in compliance, we cannot issue a permit.
right. But you have the application.
Yes, we have the
and
application.
to do that. Okay. So let me try to put this together in a way that gives the Yangs as much flexibility and consideration, certainly regarding their the language issue. What if we said the following, that we would that they need to reduce the number of birds to 6, and they need to have the property properly cleaned, and that we would have the animal inspector go with an interpreter to the home. Let's say, I'm looking at my calendar here. Let's say on November 30th. I'm sorry, November 13th, and review through the interpreter exactly what needs to be done in the property to meet compliance. That the animal inspector would return with an interpreter the following Monday, November 20th, to further clarify if there are any questions, to see if there's progress. And that an inspection be done on November 27th. And if there's not compliance with the current regulations, then we would issue a cease and desist order and begin daily fines going forward. So that would give them 2 points in time to have clarification and 2 weeks to fix the problem before the cease and desist order. You know, the
So-
concern here is that in terms of public safety and public health, is that these conditions can lead to rodent infestation and ultimately impact the entire neighborhood. So it's not something we can kind of sit on forever. But we do want to take into consideration adequate time to do it and clarity. Paula, you have a comment?
If I could add just one point to that for what you said, Rick, if I understand Madam Yang's point of view, she did say she cleaned it up, but the birds pooped again. So I'm thinking that there needs to be some education around maintenance as well as cleaning.
Well, that's
So-
I'm presuming that conversation would take place on the 13th and 20th. And also, if the Yangs do reduce the birds from 20 odd to 6, there's a lot less pooping, and you know it's easier to keep clean, and so forth. A
So
day.
just two things I would like to mention. The inspections are supposed to be unannounced inspections. So we cannot tell them we're going to be out on the 27th. If we do that, then it's going to be a perfect situation. Everything is going to be fine. And then we go back on the 28th. And then, you know, it's something totally different from what we saw a day before. That's the first thing. And the second thing is the issuance of the permit is contingent upon a successful inspection. And during the application process, they have to demonstrate to us how they're going to keep the feed, how they're going to maintain the property, clean the waste, the animal waste, how they're going to keep rodents out, what types of containers they're going to put the feed in so that rodents don't go in. So all those things are part of the application process.
Yep.
But they're not executing everything they said they were going to do in the application. So the application says this, but in real life, you're seeing something different.
Right,
Mhm.
right. I was actually thinking that the 2 visits on the 13th and 20th were not really inspections, but were sort of guidance to make sure that if they had any questions, that they were making progress to, you know, to be able to implement what is expected. So those questions about, you know, do they have adequate space per bird? How are they cleaning up after and how frequently? And those 2 visits with an interpreter would really be more of a support to them to have them execute. If you'd like, we don't have to plan a permit inspection on the 27th. We could say there will be a random inspection at some point after the 27th. And based on that random inspection, you know, we'll either order a cease and desist order or we'll, you know, give them a permit. So I was really thinking of those 2 visits as sort of a support to try to make it clear in their language what they have to do by an expert over a 2-week period. And then after that, random inspection, they either get cease and desist and $100 a day, or they get their permit. So that would be an approach that seems to give them time, addresses the language issue, make sure they understand what's going on, but also, you know, will allow us to, you know, make a decision at some point after the 27th to go in and either give a permit or, so that would be my recommendation. I don't know if I can put that in a single motion, but maybe Cassidy can formulate that in the minutes. Kevin.
Quick question in regards to spot checks. If they're not allowed in a day, are they also not allowed to fine?
Well, we can conduct a plain view inspection,
Hmm.
and we can find based on the plain view inspection.
I just want to make sure it's clear to the Yangs that if we do have our animal control officer come out on a unexpected visit, that there is going to still be a fine for not allowing them in, that it's not as simple as not allowing somebody in. So I think I agree with Rick on that it needs to be clearly communicated to them in their in their first language, exactly what is expected of them, and what, more importantly, what it looks like if that expectation is not met moving forward. So I'd agree with everything Rick said, and just making sure that those 2 points are driven home as well.
I
Yeah.
agree.
Can I speak? Actually, I forget to say, already cleaning up the board. Whatever he told me, already cleaning up the board, the hay. Yeah. Yeah. Okay. Yeah.
Yeah.
Yeah. Right now it's followed. Yeah.
Yeah, it's yeah.
Yeah. Follow the rule. Yes. Follow the clean up that keep the 6. Yeah. Yeah.
So, but what I'm getting, I don't know if we have to take a formal vote on this, but I think that a day you have a sense of what the board would like to see, and it may be worthwhile to have this communicated by an interpreter, and set up an appointment for the 13th and 20th, and to help them through the process, and explain exactly what the expectations are. And then, come last week in November or sometime in December, if, things aren't changed, then you would need to move ahead with the cease and desist order.
All right.
Carrie?
I agree with everything you said, Rick. I want to echo Paula's suggestion of, if it's possible, to engage social work in this conversation as well, that may be useful. I know we heard it, but I think that might be want to make sure that it gets included in the recommendations or suggestions that we have.
And
Good.
social work 我们怎么着？这个呢，
Ms. Yang,
现在
a day's office will be in touch with you, over the next few days to work out a plan to help you reach compliance with the regulations and obtain a permit. So you'll be hearing from his office, probably through an interpreter.
OK，
他家呢？他家那
加上
yeah. Okay.
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 Very good. Thank you
Thank you.
thank you for coming and attending the board meeting. Appreciate it.
Thank you much.
All right.
Okay, 找老哥了。
Thank you.
Okay, thank you.
Right.
Okay, Day.
So
You want to introduce Annette and
yes, so as you all know, we have a shared services public health collaborative with the towns of North Andover, North Reading, Linfield, and the city of Haverhill. Annette is here, and I will now ask her to give us an update on this collaborative. Annette is our shared services coordinator. She joined us in the summer, and she's been doing a terrific job since then. And just a quick background information, Annette. Reading's Board of Health consists of 3 members and 2 associate members. Dr. Lopez is the chair, Kerry is the vice chair, Paula is a member, Kevin is an associate member, and Jerry is also an associate member. We are in the process of increasing the composition of our Board of Health from 3 to 5 members. So feel free to proceed with your updates, and thanks for joining us again.
Thank you so much for having me. It's great to meet you all virtually. So Ajay gave a little background about me. I started with the collaborative in June, and I come with a background in local public health, both on the programming side and then the inspectional side. So it puts me in a good place to kind of think of this holistically of how are we improving public health services from inspections for nursing within the region. So this year in fiscal year 24, our collaborative was awarded a little over $530,000, and we took this and built a work plan around it. So this year we have 3 main objectives within our work plan. The first is to expand the capacity to meet public health performance standards across the region, and we aim to do this by increasing our shared governance structure. So we're currently in the process of developing an intermunicipal agreement. Right now it's in the hands of the North Andover legal team just to review and work with the Massachusetts Association of Health Boards to finalize that language. Once it's finalized, we'll be presenting to all the municipalities in our collaborative to their boards of health and chief executive officers to implement that. We also hope to meet this goal by expanding data collection across the region and using that to develop regional programming aimed at meeting some of the gaps that we identify through that data collection. Our second goal is to expand food protection services across all communities. And so we're hoping to achieve this through hiring a regional inspector and also working towards the FDA retail food safety standards. So this will help us, establish shared guidelines for how we're conducting inspections, how we're training our inspectors to make sure that across the region, all municipalities are receiving the same excellent, services for food protection. And then our third goal this year is to expand our public health nursing services across the region. And so we aim to do this by hiring a public health nurse, supporting disease investigation, and then providing health program to all members of our region. So lofty goals, but I think we're on to some good progress. So far this fiscal year, we've hired 2 positions. One of them is myself. And then just a few weeks ago, we had our shared health inspector, Eleni Almonte, join us. So she's in the process of shadowing in all the different municipalities and working with the local health inspectors to learn what those local procedures are for food inspections. And once she's trained, she'll be available to help support all of the participating communities and making sure that they're accomplishing all of their regular and re-inspection for food safety. As I mentioned, we're in the final stages of reviewing our intermunicipal agreement. So that will really set the framework for how we work as a region, and will be governed by an advisory board, which will represent all 6 of our communities. We're also in the final stages of offering a public health nurse position. So we've completed all of our interviews and are working to extend an offer. So that will be great to have that support person, especially as, folks are still in the middle of flu and COVID clinics. This position will be able to help support all of those operations. And then our last achievement so far this fiscal year is we've established an inspection subcommittee. So this consists of inspectors from all the different communities who are going to come together on a monthly basis and work on some of our objectives for inspection specific projects. So it will be things like working towards those FDA retail standards, One goal that we have as a group is to establish a regional mobile food permitting program to help better utilize some of the resources. And so, Reading and Andover and North Andover aren't all conducting inspections on the same food truck to really help us be efficient with our resources. So we're excited to get that off the ground. We're meeting for the first time next week. So those are really our main accomplishments so far, but I'm happy to answer any questions folks may have, about what we're working on and hoping to accomplish this year.
Thank you, Annette. Appreciate it. Paula?
The nurse position that you're hiring is for the shared communities, or is it specific for Reading?
Yes, so all of the positions that are hired under the grant are for the shared communities. So they're certainly there to help. I know Reading currently is in the process of, interviewing another nurse, but that position's available to all communities to help fill any gaps that may be present.
Thank you for clarifying.
Carrie? I'm surprised you have a comment, Carrie.
Hi, Annette. How are you?
Good, how are you?
I'm good, thanks. I'm curious. Have you done any engagement with the training hub that that this collaborative is part of? Do you know if there are any plans for training or joint training? I know we're getting ready for we're still waiting for the MassFit Food curriculum to be completed, but there's opportunity for things in the interim. I'm just curious how you might be taking advantage of those opportunities.
Yeah, definitely. So our field training hub, I think, is a little on the later end of getting started. I met last week with Elsa Zhao, who's our local trainer, and she just started a few weeks ago. So she's still kind of learning the ropes, and they're developing what their programs are going to be. And so I communicated some of the needs that I've heard from the municipalities for training, and definitely they include the MassFit courses, both housing, food, and that's certainly in the works and one of their priorities, but they're not up and running yet for us to be able to take advantage of. The other thing that we're hoping to work with the field training hub is Elsa is luckily an FDA standardized inspector. So we're hoping to utilize her to help standardize first we're going to do our regional inspectors, and then our regional inspectors will be able to go out and standardize the local inspectors. So kind of a train the trainer model for getting all of the municipalities, meeting that standard. And basically it just sets forward, this is how we train inspectors to make sure that everybody's receiving the same instruction, standardizing how they go out and do inspections. So that's one project that, I've talked to Elsa about and hope to, as she's still getting up and running, so it's not quite ready, but once she is, that's definitely one of our top priorities. And we also talked about the need for some additional lead determinator field opportunities and training. So I think that she's also talking to the state on how to increase that capacity.
Awesome. And in full disclosure, Elsa is a colleague because that hat I took off at the beginning of the meeting as a manager for a regional training hub. So the 10 hubs in the state are the trainers and staff are meeting regularly. We just actually had a meeting earlier this week, and we all kind of share information of what the interests and needs are. We are not competing with each other. So yeah, I know that Elsa was talking about that. I'm interested. Would part of the FDA food standards thing be maybe a presentation to the different local boards of what does it mean to do FDA standardization, and what are those standards as opposed to just the food code? Is that something you would consider?
That hasn't come up, but it certainly is something that we'd be happy to do. I think that would be great, to help kind of explain it, because I don't even think like all inspectors in Massachusetts are quite clear what the difference is or what the standards are. So I think that's a great idea. That's something I'd love to come back and do and offer to the other communities as well.
Great. Yeah, because there's a part of it is kind of a buy-in process, working with working with the folks that we inspect. So, but that's great. Thank you for the work you're doing. I'm really excited that Reading is part of this. Thank you.
Thank you.
Could I ask around software systems or systems used to standardize, inspection processes and other things? Is that part of the goal of the shared services?
Yes, it is. And thank you for asking, because I'm remiss not to have included it in our achievements. But we are working to purchase the relevant inspection software, which I know Reading is already utilizing. So 3 of our communities actually already utilize Relevant for their food and housing inspections. And so the other 3 communities have agreed to purchase that through the grant. And so we're just currently in the process of, having all town councils review contracts and signing them. And we're hoping to implement it by the end of the year. And one of the big benefits of that will be that the regional inspector positions will have access to all 6 municipality records. So they'll, seamlessly be able to go cross jurisdiction and perform inspections. And then that data will be readily available to the local department to review as well.
Great.
And the advantage, sorry, can I just say, right? I mean, the flip side, the advantage to this from the business owner perspective is, again, that it's standard across all jurisdictions, and the variation from zip code to zip code will begin to disappear. And that is definitely a concern I've heard about. Is that right? Yeah.
Yeah, definitely. That's a great point. And a lot of the other collaboratives are buying onto Relevant as well. So, we won't have access to their records, but if somebody owns an establishment in our region and outside our region, there's the possibility that they have that continuity as well.
Great. Thanks.
Sort of one comment and then another question. This implementing these software systems in the various communities is a great thing. But having been in medical practice and seeing how medical record systems evolve, even if they're the same company, like Epic, every medical institution or organization has the same software, but there's no linkages. And so there might be something to think about down the line. I don't know whether the software company that everybody's buying into has the ability to create linkages so we can share data across, but that's just a comment. The question is, at our last meeting, Carrie introduced us to the performance standards for local public health. And how do those standards fit with your efforts to standardize performance across, all 6 communities?
That's a great question. So, this grant was really formed to help municipalities achieve those performance standards. So as we developed our work plan, at the core of each of our objectives and goals were those those performance standards. So we really make sure as we developed that work plan that we could make a clear linkage to how this activity is going to improve our ability to meet those performance standards. So, purchasing the software for inspections will help make sure that we're meeting all of the order letter requirements that are outlined in the CMR for housing inspections, because it'll already be written into the software. For food inspections, it'll make sure that we're checking for all of the priority foundation and recording it properly. So it really was at the core of how we developed the work plan, and we have set goals across the fiscal year. And part of it is looking at ways that we can measure it to make sure that we're hitting those goalposts as we move along, and increasing that ability to meet those performance standards.
Great. Any other comments or?
No, just to say welcome aboard. This is
Yeah.
very exciting.
It is.
Exciting.
Yeah, excellent.
Happy to have you.
Thrilled and very
Thanks so much.
supportive.
Well, I'm very happy to be here, and I appreciate you guys letting me have the time. And I look forward to coming back and providing more updates in the future.
Great.
Sounds good.
Thank you so
Excellent.
much, Annette.
Thanks, Annette.
Thank you.
Good
Thank
night.
you.
Okay, update on Bill 2072. I had forwarded you the email from a couple of weeks ago as the wheels of government turn so slowly. So this bill was introduced in the beginning of the year. As of October 20th, when Michael Smith, who's a Deputy Chief of Staff to Representative Jones, emailed us that I forwarded to you. So basically, it's gone through the processes in the House. It's now in the Senate. When the Senate finishes it, it will send it back to the House for a vote. Then it goes back to the Senate for a vote and then to the governor. So I'm hoping that it gets concluded in this session of the legislature. I'm not an expert on governmental processes, but I seem to think that every new session of the legislature starts all over again, and hopefully that's
Yes.
not the case. Is that true? Is that
It is true. Yes.
that happens?
The slate is wiped clean, and then you have to refile anything that didn't make it through. So,
Okay.
but hopefully, and I'll say, so I must have missed something, because the last message I saw was that it had gone to the committee on third reading, and I was a little alarmed. So I'm glad to hear that maybe it's come out of that committee, because if it's still in that committee, then I need to make we maybe need to make some phone calls.
Okay. So what he said was that it was moved, this is as of October 20th, that it was moved to the Senate Committee on Bills in the third reading yesterday afternoon. The next step in the process will be for the Senate to engross the bill, after which it'll go back to the House for
Okay.
enactment and then to the Senate.
Okay.
So,
yeah.
hopefully.
Sometimes the committee on third reading can sort of be a like getting on a local train, right? Like the train doesn't go all the way to the to the end. That's it. But that may have changed, since my working with it. So I'll ask a question. Thank you for
Sure.
keeping up on it for us, because we want to be able to work with our other members here.
I will prod Mr. Smith in a week or two and see where it is, and then we'll let you know. Okay. So Aday, monthly report.
All right. So in the month of October, we conducted 14 food inspections. We had to go back and re-inspect 4 out of those 14 food establishments: Cumberland Farms, Cafe Nero, Stop and Shop, and Starbucks on Main Street. We received 2 food complaints, one about rats in the food establishment, and the other about the food not being hot enough. We inspected 3 temporary food events, and 2 at the Reading Memorial High School, and 1 was a catered event on Main Street. We had 2 housing complaints, 601 Haverhill that we talked about earlier, and then a property on Browning Terrace. And then we had 1 solid waste complaint. And let's see, it was about excessive trash on the curbside that was taken care of. We also had a complaint from the skating rink about kids playing on used ice. That has been taken care of as well. In terms of nursing, we had 3 COVID and flu clinics in October. We had a high turnout. And in November, so far, we've had 3 flu clinics and 3 COVID clinics as well, just because the holidays are around the corner, and we want to make sure we get people vaccinated. for the holidays. Our next clinic is scheduled for December 1st. And I would just like to take this opportunity to remind our residents that free COVID test kits are available at the town hall and the library. If they don't feel like coming to the town hall or the library, they can just go online, go to covid.gov/tests and order your free test kits. They will come right to your doorstep. In terms of disease surveillance, there was nothing on Maven. COVID was 0. We had 0 reports of any kind of reportable disease on Maven. So it looks like things are looking great in red and nobody's getting sick.
Tap wood.
If only that were true. Ade, may I add to the, I'm sorry, Kevin. To the COVID tests, for the public's information, the ones that you get from the government already say they're expired, but they have revised the expiration dates, and those dates are available online as well.
Right.
Correct.
Thanks, Paula.
I just had to ask, because I saw this in the report today. The kids playing on the used ice, I'm trying to fathom the Board of Health's involvement in that. Can you maybe clarify how that works?
Well, I mean, so the way it works is, you know, it's more about air quality for us when we do our inspections. We want to make sure that the air quality is great and we limit the air concentrations of carbon monoxide and nitrogen dioxide. That's the main thing we do with skating rinks. So I'm not really sure.
But this is outside in the parking lot, right? 'Cause
Yes.
they dump their ice in the parking lot, not in the building.
Yes.
Okay,
Yes.
all right. Just wanted to, this seemed like more of a, an ice rink authority issue than a Board of Health issue. I just want to make sure folks are, you know, putting their complaints in the right box, so to speak.
Correct. But once we get a complaint, you know.
Oh, I know,
automatically
you
we have
gotta
to
run it down.
respond.
Yeah.
Correct.
All right, thanks.
What about our RN recruitment process? How's that going?
So nurses are like hotcakes. Like it's unbelievable. Like you schedule interviews with them and they don't even show up. That's how, I mean, there's so much demand right now. We interviewed 2 candidates. Everything seemed well. One of them, you know, pulled up last minute. And the other one, you know, we did the second interview. She was great. We actually offered her the job. And it's been 48 hours and we haven't heard back. So, you know, I don't want to get anybody excited, but I don't think she's going to call back, but we'll see.
Okay.
So fingers crossed. Let's just, you know, keep our hopes down. Exactly.
Do we need to think about the salary?
Well, yeah, we increased the salary. You know how the town did a salary study and things like that. So we raised the salary, but again, in the private sector, the nurses make more money and they, you know, prefer to go to the private sector.
Mhm. So we know we're comparable in offerings as compared to shared service, other shared service postings
Absolutely.
or other communities. Okay, so we know that
Yes, we
we're
are.
competitive with that. Okay.
Right. The only other thing I'm thinking about is so we used to have a part-time nurse, right? And because of
Mhm.
COVID, we went to full-time. I don't think it would be appropriate to go back and ask to reduce the hours to part-time. I don't think so. But another way to go about it is take the hours down, increase the pay, and I'm positive we're going to find somebody that wants to do it.
Maybe more vacation time? I'm just
Well,
throwing ideas out
I
there.
mean, a lot of people want to work from home now. They want to do remote work, hybrid. So I'm
Mhm.
gonna go back to the drawing board and see if we can come up with something,
Okay.
but we'll see.
And yeah,
Well-
I shook my head big no when you first started saying reduce the hours and go back to a part-time position. But then I'm just because, you know, we have needs, right? We don't want to reduce what we have, but I think we should think about, you know, what are the needs and how we answer that in light of shared services availability, right? How much is shared services going to support? And if you absolutely can't find someone for a full-time position, does shared services provide enough of a buffer to make that other option something to consider?
It's going to be a
Or
tough
job-
sell.
Job sharing, maybe.
Oh,
Well,
interesting.
I was just about to say that, Paul. It's a great idea because you look at it as an FTE more than an individual, right? We have
Yes.
X number of FTEs to fill. How many individuals fill that is a different subject matter.
Yes.
Now, I know
Very
that
good.
it's more complicated, but you know, maybe you do have applicants that are just not applying because they're looking at what the hours are. If they knew that there were more reduced hours, they, you know, maybe this would be a second position for them, something that they would take up, you know, as a short, you know, part-time hourly thing. So even looking at 2 or 3 people to
Right.
fill those FTEs,
Right.
it's almost worth it to throw it out there in both scenarios, you know, where you can say, we are looking for full-time, we'll gladly take a full-time. However, we're also looking for 2 or 3 part-time to fill these hours and, you know, we can work around your schedule. Maybe worth it as a feeler
Sounds
anyway.
like a good idea, but it looks like we're going to have a HR constraints, you know, HR restrictions.
HR constraints, yeah.
Well, they
Okay.
did have it back when I was doing it. There were 2 of us sharing the job. But that was 100 years ago.
But yeah,
Yes.
if this doesn't work out as planned, then I'm going to go back to the drawing board and see what we can come up with.
Yeah, I think for nurses in particular, many jobs are less than 40 hours a week. Full-time at the hospital might be 36. So someone who has kids might want 24.
A good point. I mean, I think a nursing degree is so you can do so many things with a nursing degree, and you can make a lot of money, or maybe lifestyle is more important to you. You know, you could work in an intensive care setting, 40 hours, 50 hours a week, and probably make a lot in the hospital. But that's going to be a different lifestyle than working as a public health nurse, particularly if you're working 24 hours a week. And it's a different type of work. It's valuable as well. It's just different. It's different to be a school nurse. It's different to be a visiting nurse. So I do like the idea of potentially, job sharing. That also gives you a lot of flexibility because you may have 2 people who have different sets of skills, and you can apply that. You can apply them differently to optimize it. In terms of, we're getting towards the end of the year, in terms of re-permitting food establishments, is that going okay?
Yes, things are going well. Cassidy and Jen have been terrific at making sure things are getting renewed, permits are getting renewed.
Good.
I would say we're at about 40%. Cassidy, does that sound accurate?
That's good.
Yeah. So hopefully we'll get to 99.99999 by December 1st, 31st.
Okay, anything else? So in terms of some comments, final comments. I just have a couple things I want to mention. One is, we talked last time about a nicotine-free generation. And so I think that is something that still is on the table for us to have a broader discussion, to review language and so forth. But the thinking is to wait until the Supreme Judicial Court gives its findings or its results based on, I think there was a hearing on November 6th, although I couldn't find any information about it. Because I think that whatever they come out, obviously if they nix the idea, that's a big problem. But they may come out with nuances and caveats about how it has to be structured that we would want to incorporate. So, and I think we can incorporate it and do it fairly quickly, but we're waiting for those findings. I did go to the Stoneham Board of Health had a public hearing on this a couple of weeks ago. That was kind of interesting. There was about 30 or 40 people. It was an in-person hearing, and about a dozen people spoke, both pro and con. What I would say is that on the con side, the two major issues were one was loss of business by the retailers, and the fact that people will just go to another town, another state to buy products, which is true. Although what we're trying to do, I think, is to create a groundswell, and so that many communities, or maybe the state, will adopt it. And then the other sort of argument against it was around loss of personal autonomy or freedom or decision making. And I think what, Maureen made a good point that, Busby, that, it doesn't take very long in the use of nicotine to become addicted. And when you're addicted, the whole idea of freedom of choice becomes a little bit cloudier because of that, particularly if you're young. So anyway, it'll be interesting. Just to let you know that it's still there. It's on the table. We will get to it. There's no December meeting, as we discussed. If there is an urgent need to meet, we'll go ahead and schedule that for a particular reason. But otherwise, our next meeting is in January. In terms of the community health needs assessment process, we had a planning meeting, but it was somewhat sparsely attended. So the plan is in December to have a planning meeting to go over in detail the data, both from all the sources, and of course we're sharing it with everybody on the board, and then probably bring it back to the board for a formal discussion in January.
And Rick, that's a posted meeting for us, right?
Say that again?
That's going to be a posted meeting for us in December?
Yes, all the planning committee meetings are being held as posted meetings, and we have minutes, and so we're following.
Great. I think if I can, I want to jump in on this one. That was an interesting read through.
Yes, yeah, on the survey.
Yeah.
Very.
And then lastly, I'm still trying to wrap my head around the performance standards for local public health, and what we should be doing about that. It's great that Reading scored high compared to other communities already, and maybe we ought to be looking at all the standards, see where we are, and see what areas we need to improve. It sounds like the shared services program will greatly help us even improve better, but we may have to, revisit that at some point early next year.
I think that would be great. I would welcome that. I think it's great to see where we are and look at it from our perspective and not just look at the shared services as a vehicle for doing it. So thank you for suggesting that. I
Well,
concur.
Plus, it would be another step towards the excellence.
Yes, yes.
And if
You
you
know,
really want to
and-
have a little fun with it, Rick, you could actually show where we've come from to where we are today.
That's exactly right.
Just like this.
See the curve going up, right, right, exactly.
Percentage points, ratios. Yes.
It'd be a fun look at. So just
All right, anything else? Okay. Make a motion to adjourn. Do I have a second? Paula, second?
I keep going out of the screen.
Carrie,
Yes.
Paula,
Yes.
Rick, yes. Okay, we'll
Thank
have,
you all and have a good night.
have a good
Happy
night. have a good
Thanksgiving,
holiday.
everyone,
Happy
and happy
Thanksgiving.
Happy holidays.
holidays. Yeah.
Oh, see you next year.
Bye.
Bye-bye.
Take care.
Bye.
Record